Welcome back to Open Your Eyes. We're moving now into our third and final segment for the morning. Now, this one is about breast cancer. Breast Cancer Awareness Month. It's right upon us, and we've got representatives in from the Belize Cancer Society. We've got Ruth. I hope I say this surname correct. Hamarillo. Okay. Hamarillo, who is the president of the Belize Cancer Society. And please correct me following my introduction. We also have with us oncologist Dr. Ramon Yakab. Guys, good morning and welcome, Miss Ruth. Please tell me what is the proper way to say this surname.
Ay, Dios mío.
Sí.
That's a Colombian last name, so it's Jaramillo.
Jaramillo. Oh, I got it now. Ruth Jaramillo. Guys, once again, good morning and welcome. And of course, this is definitely one of those conversations, again, that we need to have because people are to be aware. Let's get on into it. Breast Cancer Awareness Month. It is the month of October, right?
Yes. That's correct. We dedicate the entire month of October under the theme I Can and I Will. That's this year's theme. And the objective is to, again, sensitize everyone on the realities of breast cancer, the current situation in the country, and how to seek assistance, how to seek early screening, and just the knowledge of the challenges we're facing as we speak due to the COVID pandemic, how that impacts our services. And the idea behind the theme I Can and I Will is just to give the reminder that we are empowered in spite of the challenges to be cognizant of this month activities and to do what we can to share the message and to seek screening if necessary. So that's the main focus of this month's activities.
Dr. Yakab, let's talk about the situation with breast cancer in Belize. What are we seeing? When are women detecting their breast cancer?
Okay, I think I'll start with numbers. I mean, for Belize, there are actual projections that place around 60 to 70 cases of cancer per year. But I think those numbers may be underestimated. What we're seeing are much more higher cases during the course of a year. Actually, for the past 2 or 3 months within the outpatient clinic, I think we've seen over 20 cases within these periods. So I think it's underestimated. The problem is the stage at which patients are reaching. I mean, it would be great to see patients reaching with a stage 1 or a stage 2, but it's that generally takes around 20% to 25% of the cases. Most cases are patients who are reaching with a stage 3 breast cancer, and around 40% of cases are patients with a stage 4 cancer. That generally impacts prognosis.
Are we seeing a rise because people are actually going in to get their checks? Because, you know, it came to mind that every year around this time, we always do a checkup with the Belize Cancer Society as to if the educational process is actually being connected. So this rises because people are actually going in to check?
It's multifactorial, John. Yeah. I'll let Ms. Ruth.
No, you're right, Doc. It's a multi-sectoral approach. Yeah. Indeed, the campaigns, the educational promotion that goes on is consistent. Also, the level of access to screening has increased with the different partners in the health response, the Ministry of Health, the BFLA, the NHI program, all of which offer these screening services for the vulnerable population, so the ages that apply. But even there, in my experience with the NHI, we have seen more and more requests for mammograms at a very early age, which is not the norm according to the regional statistics. So there is obviously a trend going on in our region, in the Caribbean, where more and more cases are being presented or diagnosed at an earlier age. That's something that I think we need to conduct more localized studies to determine what is going on in our country that can be a factor.
Yeah.
It's not only limited to that. There are other cancers, of course, but since we're focusing on breast cancer, definitely we're getting more requests. So yes, going back to your question, we are promoting. There's been more education at schools, at work, and also with different indicators that the Ministry of Health sets as priorities, in particular with the NHI program. Coverage of screening is one of the very important ones that we monitor. So we look at the population that are registered with those facilities and ensure that they've had at least a baseline study done. Doc, I don't know if you wanted to add to that.
Yes, I mean, it's important. Awareness is important, and Cancer Society has been doing a great job at that. The other thing is that the numbers of cases are increasing because the population increases, and also the risk factors associated with breast cancer on a whole. And also right now with the whole COVID contingency, well, borders are closed, and we know that patients or persons used to cross over to neighboring countries to do tests. So I think all of that.
I was thinking about that because you said, if I paid attention, you said 15 to 17 on an annual basis, but so far in the first 3 quarters of the year, we've had 20, which is more than your annual average. So could it be, and this is only 1 year in, that we're seeing a truer picture as to the number of cancer diagnoses each year because people can't leave to get diagnosed in another country?
It is a factor.
Yeah.
I mean, it plays a role.
Yeah.
As I mentioned, for the year, it's estimated to be around, it's around 60 cases, 57 to 60 cases per year.
Wow.
Okay. Now let's move into,
that's the estimation.
Yeah, move into breast cancer specifically. So this is considered one of the treatable cancers, one that if detected early enough, you can have a great quality of life moving forward with minimal treatment. But if people come in at stage 3, that makes things a lot more difficult. So how do we get people to start to detect this cancer a lot earlier? What needs to be said so we can make sure that people are detecting, accessing treatment, diagnosis and treatment, and then being able to have a good quality of life after?
I mean, it comes back again to education. I mean, breast awareness, letting every female and men also, because men do have breast cancer, let them know that starting their age of 18, it's important for women to know their bodies, do their monthly checkups, self-examinations, and if not every month, every 3 months. They know their bodies better than us. And not only that, but after a determined age 25, during the yearly physical exam, start integrating clinical breast exam where the doctors get involved. I don't think we really have that culture here at Belize within the medical community to be doing clinical breast exams on the females on a yearly basis. And also we have to analyze the different risk factors that the patients may have. For example, we do know that any female patient above the age of 40 should evaluate doing a mammogram. But we also have the smaller population, for example, patients who have had a previous history of a breast cancer, a relative with other types of cancer, which might increase their risk, and other factors that generally increase the risk to try and for us to be a little bit more stricter in terms of following them up.
Okay. Now, Ruth, we have talked about early screening, and you mentioned that you're seeing people going in from mammograms at an earlier age. But really and truly, the best detection starts with just what you do at home, whether you're checking your breast on a monthly basis. What should we be looking for? Tell us the early signs.
Well, as Dr. Jacob noted, we all know our bodies best. And the physical exam or the breast exam, self-examination is relatively easy. You literally palpate or touch your breast in a circular motion, start and going from the from the nipple outwards under the breast, as you see illustrated there, and are looking and feeling for any unusual lumps or unusual pain, or not pain, but sensation that you may feel that wasn't there before. And the idea is that you do this regularly, ideally lying down, where you raise your arm behind your back, your head, and you palpate. And it might seem minute, but when you start to do it on a regular basis, you will start to be able to detect a difference. And the minute you do, you need to indicate that and be persistent in that message, because sometimes, unfortunately, especially if you are younger than the general age group that we screen, you might be dismissed and may say, this is just, it might be benign, nothing to be concerned about. But be persistent in that message, especially if you note that the changes are still there. They haven't gone away. Sometimes you may have a smile, inflammatory situation going on, an infection, or you may feel some nodes inflamed. But if it's persistent, you need to report it and ask the doctor. That I remind the doctor, as Dr. Yakab said, Doc, you haven't done my annual breast exam. Please do that for me. We have a tendency that we limit that exam when we go to the gynecologist, which is very interesting what Doc said. At the primary care level, we don't really request as patients that the general physician does that exam. And that's something we need to talk about and promote. Everyone should be trained on how to do the exam and when to refer. So definitely starts from you.
That's
Ruth and Doc, if we're doing this check and we feel something there, does it mean that it's cancerous? If I'm doing it and it hurts, does it mean that it's cancerous?
It doesn't necessarily mean that it's cancer, but it should raise alarm to do further testing if needed. So seek medical attention if you're feeling a lump.
Yeah. Yeah, that's actually, it's very similar to what I wanted to ask. So, breasts aren't just a smooth part of your body. Naturally, they're glands and they're lumps that you will feel. The challenge, I'd imagine, is how long people take before they go and check something abnormal. I may feel something that just feels dense, and I say, oh, well, it's nothing. What is the danger between leaving something that you're just not sure about and not going to check it? How quickly can this spread or develop into a more severe stage of cancer?
Now, it depends. When we talk about breast cancer, there are different types, and there's some that are more aggressive than others. Now, talking about young patients are characterized for having the aggressive type. This means that it could take a couple of months, 2-3 months, and the lump could actually increase double or triple in size. But in terms of time range, I think that would be important, but we also have to analyze the other factors, cultural factors, because we have patients that are noticing that a lump is growing, but because of cultural factors, they're not reaching to do their medical checkup for different reasons.
Why would you say? What do they tell you? Why they wait so long?
One, sometimes they don't think it's cancer. Another reason that's generally mentioned is that they do assume that it's cancer, but they do not want to know the diagnosis. Sometimes they do alternative treatment, and unless it's not working, that's when medical treatment is sought out.
Yeah. Well, a part of, I think, when people say they don't want the diagnosis, there are a lot of assumptions that are made with a cancer diagnosis. One, that it's a death sentence, or two, that I simply won't be able to afford treatment.
Yeah.
Let's talk about those. What is the reality on the ground?
The earlier, as you correctly mentioned, Merlene, before, if cancer is diagnosed at an early stage, the patient might only need surgery and possibly hormone therapy, depending on on anatomical factors. Now, chemotherapy might be required based on the type of cancer.
Yeah.
So it doesn't necessarily mean that the patient might require chemo, but we're going with each stage, we're increasing treatment options, so the cost will increase. Now, if I have a patient who has a stage 3, I know that that patient will require surgery, chemo, and radiation, which will increase cost to the patient. And if the patient reaches with a stage 4 cancer, then unfortunately, these type of cancers are not considered curable. These are diseases that have already spread. And what I have to mention is that once the patient is on chemotherapy for a stage 4 cancer, there is no definite number of cycles. We proceed until we have disease control. That may be 8 or whichever amount of number of cycles, which unfortunately is an added cost then to the family and the patient's expenditure. So the message here is that if it's caught earlier, it's treatable and I'd say affordable. Miss Ruth, would you want to
Add to
discuss
that.
a little bit more on that, on the costing part there on
Certainly, and as you rightly pointed out, Dr. Yakab, you have the Belize Cancer Society, which also partners with MOH and the Belize Cancer Center in Dangriga, so that some of the level of care is available and accessible in Belize and affordable, where resource mobilization, through donors, through contributions, we have been able to provide that care for those persons impacted. And it's essential that the diagnosis is done at the earliest time convenient. Again, the challenges now reflect the realities with this COVID, which has us very concerned, to be honest. The budget constraints that have been applied across all sectors, including the Ministry of Health, and the private sector, has impacted the funds that both the Belize Cancer Center and Belize Cancer Society have at their disposal to mobilize care for persons impacted. We do coordinate very closely with Dr. Yakab and the MOH to do the initial treatment as best as we can within country, and that is between the KHMH as well as the Dangriga Cancer Center. With the move to launch soon the suite in the Belize Cancer Society, we have been managing, but the funds are rapidly depleting, and that has us very concerned. Remember, the care does not just involve the medical interventions, it also involves the support to the families that take for granted, the transportation, the meals, the aftercare that those patients require to recover, the days lost from employment, or if you're employed. It has a very important and significant impact on the family. Right now, we are very concerned also with the pediatric population. Although we're talking about breast cancer at this time, we would be remiss to not mention that at this time, that we are concerned about the pediatric population, and we've had to scramble literally to seek funds to get them the care, the radiotherapy that they were provided and the chemotherapy they were seeking in other countries. And because of the COVID, that has had an impact on the management of the more advanced cancers. Dr. Yakab can speak on that, especially if we're talking about radiotherapy, which is only available in the neighboring countries for us, Guatemala and Mexico.
Dr. Yakab?
Yes, it is true, we're struggling. And I mean, when it comes to services that have to be sought abroad, for example, radiation, and talking in general about cancers, roughly around 50 to 60% of all cases will radiation at some point. And making focus on breast cancer specifically now, since most patients are diagnosed with a stage 3 breast cancer, I certainly have to mention that all of those patients should require radiation therapy.
Yeah.
So we do have limitations there.
All right. So Ruth, while
The message we are trying to say then is continuously early detection.
Yeah.
I understand the fear factor though. It is scary, especially if you have a history of cancer within your family. That makes it even more essential that you seek screening and at the earlier stages. So once a family member, especially a close family member, has been diagnosed with any form of cancer, you should especially pay attention to the screening and be cognizant that you're not alone in this fight. Definitely not. And the support provided by the Belize Cancer Society and other stakeholders is vital and has been very important in providing that level of hope that is required, to fight the fight. Because, the side effects of treatment is not easy. The support you need from your family members, especially if you're the sole income earner, you imagine what that does to a family unit. So the level of support and mental health that is required to keep you focused, engaged, optimistic is half of the battle. In fact, the main fight is your own mental state, giving yourself that ability to think ahead and saying, I can do this, I can beat this, is half of the battle.
Yeah, we hear you. We hear you. I can and I will. That's the theme for this month's celebration, right? Because while there is an awareness, normally this time of the year, we also get to celebrate. There is normally this cancer walk, and everybody could just congregate together and walk from Ladyville on to Belize City or from there in various municipalities. What will be done to celebrate the month?
Well, we'll have to rely on virtual reality.
I watch you when you walk.
But that brings up a crucial point, though. That was a huge fundraiser for the Cancer Society.
Yeah.
I mean, we see the thousands of people hundreds of people that go out, but now that you won't have that, how are you going to raise the funds that you need? Because I know you offer a lot of assistance, or as much as you can, to people who come in and need help, maybe with a biopsy or a treatment or something in terms of their cancer care.
That is the challenge we're having, and we're trying to be very creative in that approach. And I'm seeing the images being displayed there, and that's the every year we collaborate with the special envoy, Mrs. Kim Simples Barrow, and we celebrate survival by doing the annual photo shoot with women who have beat breast cancer. And you see the image there. Normally, we would do a formal launch and display of these images, but we are doing it virtual this year. And we ask you that you tune into the Belize Cancer Society Facebook page, where you will see the images so proudly displayed. Nice. The other things we are doing is we will be organizing an annual virtual cancer walk and ride. This is being planned as we speak, but we also need to engage other fundraising activities. If you recall, last year we did the famous Bollywood. Those big activities cannot be done this year. And so again, we will have to rely on virtual fundraising and asking the community to contribute amount, whatever they can, to assist in this fight. So you'll be hearing more about those launches will be coming out, and definitely we all need to be very creative.
All right.
Well, we're going to look out for that virtual walk. There are many innovative ways to try to get people on board. And we do want to remind people that since you're not having your fundraising activities, that they can always seek out the Cancer Society itself to offer support, because you use it to be able to help people in times of desperation when they need assistance with care. Thank you, Ruth, and thank you,
Dr.
Dr. Yakab. Let's hope that we all use this as a reminder to do our monthly breast check. Today, women, men, your spouses can help out if they are so inclined.
That's right.
But the key thing is catch it early, check it early, and you can definitely be one of the people who beat this form of cancer. Thank you all.
Thank you, guys.
Thank you.
Thank you.
All right. We're going to go ahead and take that final break now, and when we come back, we'll have our wrap-up, so stay tuned.